And once again, we are here with Ms. Sylvia Lemus from the County of Sonoma. Welcome to the show one more time. And again, thank you for bringing us the latest information. Today, we're going to be getting an update on COVID as well as the monkeypox in Sonoma County. So if you could share with us, again, that information so that our audience is up to date on what's going on.
Thank you, Rafael. I know it's been a few weeks I've been here, so I do have updated metrics for you. So right now, as far as a COVID update, our new daily case rates per 100,000 population is 18.9. So we have 18.9 cases, but it's really important to know the difference between vaccinated and unvaccinated. Our case rate for unvaccinated people in our community is 49 or 50 cases for every 100,000. And our case rate for people that are vaccinated is 18.5 per 100,000. So there's a big difference from 18.5 to 50 per 100,000, whether you're vaccinated or not. Our overall testing positivity right now is 11.9. So we do see that number coming down. But our equity metric testing positivity rate, which is COVID in our most impacted census tracts, is still higher. It's 14.2%. So we know that COVID is still with us. It's out in the community, and we want to kind of make sure that people continue to be safe with COVID. I also do want to share a little bit about hospitalization. Our hospitalization rates right now, we have 33 COVID-related cases in the hospitals right now this week. And of those, 2 of them are in the ICU. So we have 2 cases, COVID-related cases in the ICU. As far as deaths for the whole pandemic, we've had 509 COVID-related deaths, unfortunately. And Rafael, in the last week, we've had 3. So we know that we're still seeing people that are being affected by COVID. But one of the things that we do know is that vaccinations is our best defense against COVID-19. And currently right now, we have 78% of our county's total eligible population, or not a total population, that includes everyone from age 0 on up. 78% is completely fully vaccinated. And of the residents partially vaccinated, we have 6%. So we have 6% that have received at least 1 and haven't completed the vaccination process. So we are moving up, but we still have a ways to go. And as far as boosters, we have 65.9% of the county's eligible population that has received their boosters. So as you can see, we do have a lot of people, and we are the 9th highest vaccination rate here in the state. So we still have high vaccination, but there's still room for improvement. And especially, Rafael, as we see fall and winter come, we're going to see kind of an influx of not just COVID, but flu and different kind of illnesses. So we really want people to really be prepared and continue to really take safety measures, seriously, because what we're seeing is that it's going to be an issue of personal responsibility. Everyone's going to be individually responsible for COVID in our community. And one of the reasons I say that is because COVID resources here in Sonoma County have been cut back. Our resources have been cut from the federal government, state government level. So there's less resources, less information and things going out related to COVID, but we will still come and continue to kind of give you updates on COVID. And that's why I'm saying it'll be more of a personal responsibility situation.
Yeah, definitely. So again, just a reminder to the community, as we say to you almost every week, if you go and you happen to be in a limited ventilation type of situation, maybe a restaurant, maybe a shopping center, or other places where it's a crowded area, a little ventilation, please make sure to wear your masks, wash your hands, continue to wash your hands with soap and water. 20 seconds is what they're recommending. Warm water. Again, all of those pieces need to become part of our daily routine so that we are limited in the amount of risk that we may end up getting somebody sick. The other piece here is, again, you may be okay because you're younger, you don't have a specific illness, but maybe grandma, maybe grandpa, maybe the neighbor who's older or who has a chronic illness such as asthma or heart disease, or maybe obesity or other issues, they're more likely to be affected even if they are vaccinated. So again, we have to take care of ourselves, take responsibility for our behavior that may impact other community members here locally. And so it sounds like the CDC is coming up with new guidelines about what's going to happen with COVID.
Yes, Rafael, last week, the CDC updated their COVID-19 guidelines. So they said that the nation should kind of move away from more restrictive measures like quarantine and social distancing and focus more on reducing severe disease from COVID. There's no major changes that are expected here in Sonoma County because we have aligned ourselves with the California Department of Public Health that includes most of the new CDC measures already. In the new CDC guidelines, for example, the agency no longer recommends staying at least 6 foot distance from other people. So social distancing is not really recommended anymore. And that's a shift away from the guidance that has been in place for since the early days of the pandemic. That's a big change. The shift is a sign of how much has changed since the beginning, more than 2 years ago, and nearly the entire population has some sort of immunity through vaccination or previous infection or such. But as I said earlier, we still have to be personally responsible and still do everything we can because we are still seeing infection in our community. The new guidelines say that contact tracing, for example, which has been another hallmark during the pandemic, should be limited to hospitals and certain high-risk group living situations like nursing homes. And the guidelines also de-emphasize the use of regular testing to screen for COVID, except in certain high-risk settings like nursing homes and prisons and jails. The new guidance also does not advise quarantining people who have been exposed to COVID but are not infected. The guidelines do keep some measures the same. It encourages testing for people with symptoms and their close contacts. It also says people who test positive should stay home for at least 5 days. That's a difference from what we were doing before. And wear a mask around others for 10 days. It also continues to recommend that people wear masks indoors in about half the country. So there's our area of the countries that they're recommending masks. The new guidelines also changed the advice somewhat for isolation for people who are very sick from COVID. People with moderate symptoms, such as shortness of breath, and those who are hospitalized should stay home for at least 10 days. People with compromised immune systems should talk to their doctor about ending their isolation after infection. They should really consult with their doctors. So those are some of the changes, but as we shared the numbers with you of people that are still being hospitalized, we had 3 people that died just this last week from COVID. We kind of need to adapt a personal responsibility kind of a perspective on COVID here locally.
Definitely, and just a reminder to the community is there is about 79% of the population in the United States is vaccinated with at least one. So that it's a little bit lower. This is in the United States in total. It's a little bit lower than what we have here in Sonoma County, or just about the same, right? But that means that there's still millions of people who are not vaccinated. And California being a beautiful country, as I like to say, we are so different than the rest of the nation. Everybody wants to come and visit California. So there's going to be people flying into Sonoma County or visiting Sonoma County that are not vaccinated. So please be careful. If you go into restaurants and other places, wear your mask, limit your physical contact with other individuals. And so there's that. But then we also have monkeypox. What can you tell us about monkeypox?
Yes, Rafael, when I was here a few weeks ago, I had shared some information. And one of the things is we had 8 cases, confirmed cases at the time. Well, now we have 27 cases, Rafael. So we are seeing an increase in the last few weeks of monkeypox. We are still focused here in Sonoma County on the population that's most affected, which is men that have sex with other men. And so we are focused our efforts in that community. And we do have a vaccine, but the vaccine is limited right now. And so what we're doing is we're working with our clinics and training our clinicians to use a different method of administering the vaccine so that less of the vaccine, I'm not sure if it's maybe half the dosage of the vaccine is used, using a different method, which is more like an intradermal, using what they call a dead space small syringe. So it's a different type of administration that allows the vaccine to go longer so that we can make more of an impact here in our community. But it is here and we are working on it. And we're kind of working with that community to try to do everything that we can to also stop the propagation of monkeypox here.
Definitely. Again, we need to take care of ourselves. We have COVID, which has become an endemic situation. That means it's not going to permanently disappear. It's just like the flu. And from time to time, we will be getting the newest shot to be able to prevent us from getting sick. And then we have monkeypox now, and we need to be careful. And that one is transmitted mainly through sexual contact. And although while the LGBTQ community has been most affected by this, they're not the only one. And it's important to bring this up only because nationally, a lot of the news media has been putting the idea out there that it's only affecting the LGBTQ community, and that basically the rest of the community or the country, it's fine, and it's not. And so it's important to keep that in mind. So thank you for mentioning that. And then the other piece is, we have the fire. So it's important for us. It can be overwhelming. Let's make sure we take care of each other. Let's make sure we talk about these things with our children to make sure that they are protected as well. And so it also seems like the county is going to move towards basically limiting some of the resources that they have been making available during COVID. But the SOCO emergency.org will continue to have a lot of information for us.
Yes, SOCO Emergency will continue to have information about where they can get vaccines, where people can be tested. So we'll continue to have that information updated on our SOCO Emergency, as well as, like you said, wildfire information, how to prepare a go bag. There is, like, for example, tonight at Roseland, this evening, there is an emergency preparation fair that's being done in partnership with the county. And that's going on around different parts of the community, emergency preparedness fairs and festivals. So it's really important to go on there. It's an important website. There's a lot of emergency information on there and how to prepare, where to find sites. And also people, for the vaccine part of it, if people have questions, they can call. We still have our hotline open, which is 707-565-4667. And it's open at least for another month. I'm not sure how much longer, but people can call there and they can get assistance and help on where they can go get a vaccine or testing. It's available in English and in Spanish as well.
Definitely. And so, as always, you bring the latest information. We're grateful. We know that you cannot be here every week, but again, for as long as we can, I think this collaboration is essential. The community needs to get the information. So I want to thank you, Ms. Lemus, for taking the time and being with us today here on KBBF with that information about COVID and the monkeypox and additional information about resources. So thank you for your time.
Thank you, Rafael. Glad to be here.
Take care.
Okay.
Bye-bye.